6 years ago, I barely knew what multiple myeloma was. And then suddenly I was diagnosed with it. And of course, it was stunning to me. I did have a very lucky life. I had no real interruptions in my life. And everything was going well. I had great kids. Wife was very accomplished. I could go anywhere in the world and cover things. And then, as you know, I was very active athletically. I was climbing mountains and skiing and bicycling across South America. And I had back issues. So it got a little worse. And the orthopedist continued to say, it's your lifestyle, Tom. And a very smart guy that I think you've come to know at the Mayo Clinic, who was an internist, frankly, said something's going on. And he figured it out. And it was stunning to me to have somebody say to me, your lucky life has been interrupted, in effect. It did teach me humility. It also taught me empathy. And then most of all, I got to know you. I got to know the dedication of not just you, but all the laboratory technicians, the other people involved in multiple myeloma. And I've been astonished at how much progress has been made in terms of understanding it. Am I wrong on that?
There has been remarkable progress, Tom, in multiple myeloma. Several decades ago, we had just standard chemotherapy, and then came along high-dose treatment and stem cell transplants. But literally in the last 15 years, there's been a revolution in novel treatments, such that now when a patient comes along with myeloma, a bone marrow cancer that can cause bone disease and kidney damage and high blood calcium and low red blood cell counts, when somebody comes along, we can now use combinations of novel treatments, and the vast majority of people respond. And many people, the majority now, have myeloma as a chronic illness and grow old with a normal lifespan, as we all do. So it's been a revolution in new myeloma treatments.
One of the things that's striking to me as well about it is that in a lot of the cancers, lung cancer, for example, and others in which you get exposed to chemicals, we kind of say, well, that's the source of it. That probably begin with that. But that's not the case with multiple myeloma. Where did it come from?
Truth is, even today, we don't know the answer to that question. We know, Tom, that certain factors are predisposing or risk factors for the development of myeloma. And so, for example, in the environment, exposure to pesticides, whether it be farmers or soldiers in Vietnam having been exposed to Agent Orange. But perhaps the biggest risk factor for developing myeloma is this earlier condition called monoclonal gammopathy of undetermined significance. It tells you we don't know for sure what it means.
I like that undetermined part of it.
Well, we're here today because we're going to change that undetermined. But it turns out that a fraction of people, as increasing fraction as you get older, develop a monoclonal protein in the blood. It's called this monoclonal gammopathy of undetermined significance. And a small fraction of them over time develop an intermediate phase called smoldering multiple myeloma, and then the form-fruste multiple myeloma with complications.
And we know that every single patient who's diagnosed today with myeloma would have had a precursor condition for 10, 15 years. But we don't know about it because we don't look for it, we don't screen for it. And yet when you go to your primary care doctor, you screen for colon cancer, you screen for prostate, women screen for breast cancer. We don't screen with a simple blood test for myeloma. Wouldn't it be amazing if in the future we say, before you had the bone pain, before you had anything, you had a blood test that said you have a precursor condition and you may have myeloma 5 years from now. And guess what? We can do something about it.
That would have been very helpful to me. And I had, routine physicals at the Mayo Clinic and other high profile places. It never came up. I didn't have any blood issues, for one thing. I was a healthy guy by and large. So I do think that it's tricky. You don't want to send people into a panic. You want to do it in a way that they understand these are things that we have to start thinking about, not just as laymen, but also in the medical field as well. As somebody who's watching this or is aware of multiple myeloma or as a friend or relative, and they want to get involved, what is it that they do?
I think the first thing, and we try to make it easy and simple, is they can go on promisestudy.org and see if they're eligible or not. And there are 3 or 4 questions. And if they are eligible, we send them to a Quest Diagnostic or any lab they want to go to. And it's a very small, simple kit with 3 tubes. One of them goes to Mayo Clinic, where we can check if they have the protein in their blood, and the others go for research. And if they are positive for the protein, then we call them, and we've called many people telling them about it. And I was surprised actually when people answer the phone and say, I'm happy to know now because I can do something about it. And I was actually thinking maybe people will be anxious, they don't want to sign up. But actually, every single person we talked to said, my mom had this and I want to know about it early to prevent it. I want to know when I'm early precursor and not know when I have a fracture in my bone 10 years or 5 years from now. And it was very different for me to see that enthusiasm and that excitement from many people. And seeing them in the clinic and following up with them. And right now, MGUS, we just follow people very carefully. We do a lot of research studies. The hope in the future is we have a vaccine, we have a drug that prevents completely myeloma, but even close observation can improve survival, and that has been shown because you detect it early and you can treat the patient early before they have the fracture or the anemia or the kidney failure. So just by knowing early and seeing the doctor is a step forward for every patient.
You know, people are watching this, many of them are family members, and if they don't have somebody who has multiple myeloma, they may at some point. What is it we say to them about what happens if a member of your family has multiple myeloma? What can they do for them?
Every single patient we've seen currently with PROMISE study comes because mom had myeloma, dad had myeloma, and I wanted to know. We have 7 siblings who all screened at the same time. And it's so nice to see families come together to say, if one person had it, we all want to know whether we're at risk or not, and can we do something about it.
It's identifying people who wouldn't even know that they have an abnormality at a time when we hope we can prevent them from getting disease.
In my father's family, there were 2 or 3 cases of leukemia, for example, you know, and I thought, well, maybe there's a dotted line there at some point. To what was going on, a blood-related cancer at that point. And what I think is most heartening to me is that people are eager for information.
We're working very closely with the School of Public Health, the Harvard School of Public Health, on asking the questions, if you inherit something but you then get exposure, will that increase your risk to develop myeloma versus someone who gets the exposure and never had that inheritance? So it's definitely much more complicated than what we know, and that's why it's very hard to diagnose early and to understand what causes myeloma. But we're getting to those very first early events in the PROMISE study to try and understand what causes that early event in those patients.
When I was first diagnosed, obviously with my curiosity, I was going around and saying to other physicians, when did you first know about multiple myeloma? And I remember there was a wonderful surgeon at the Hospital for Special Surgery here in New York, a woman who has multiple myeloma, very athletic.
Know her well.
And she said all the cases that I knew about were African-American men who were 65, you know, in that age group. So do we know why?
Yeah, we don't know why African Americans have a higher incidence of developing myeloma. We know that it's 3 times higher than the Caucasian population. And one of the studies that we're doing now, the PROMISE study, is for the first time asking the question, can we screen for it early in the high-risk population? And that's the African Americans as well as first-degree relatives of people who have myeloma.
And you and I have talked many times about this, but in our world, access to medical care is not a fair game. And I think the PROMISE study is going to try to go a long way in the area of multiple myeloma to fix that problem.
Well, I would just like to say that I didn't volunteer for multiple myeloma. All things considered, I'd rather not have it. But in a way, it's been a privilege because I've learned so much about the medical community. I've made friends as a result of this. I'm aware of the vulnerability that the human body gives you. And I'm also, in many ways, at a time in our lives when people are wondering about, why am I here? What is it that I should be doing? The cancer research, especially, is something that is so meaningful to people, and it really does make a mark. Thank you both very much.
Thank you.
Thank you very much
for your great work.
Thank you, Tom.